As people seek ways to avoid institutionalized care, the increase in home health care and non-medical home services is quickly taking the place of traditional care options such as nursing homes. At the end of this presentation, you will understand the various models of home care, the hidden risks and liabilities with certain models of home care, who pays for home care, and key issues when selecting a private duty home care provider. Who is a candidate for home care? Anyone who is having trouble performing basic activities that maintain daily living may benefit from home care. For those who stay in their own homes or go to a congregate housing situation when care needs elevate, there is the option to hire private duty assistants to help with care. Medicare does not cover this service. Government funding, local as well as national, is limited for this type of care. However, it is available. Private duty services are paid directly by the patient and his or her family members or by long-term care insurance. Although most commonly paid from the client's own resources or insurance, there are some public sources of assistance. It is important to become familiar with the types of private duty providers and the issues and challenges associated with each. The first model of private pay home care is the full-service agency that employs caregivers, monitors and supervises care, and provides W-2s to their employees. Benefits include monitored care, supervision, and backups to scheduling. Long-term results are following a care plan that means appropriate care. And costs are more expensive at the outset because of value-added services. The next model of private pay home care is the nurse registry or healthcare registry that simply matches client and caregiver and does not employ, train, monitor, or supervise workers that are sent into private homes. The benefit is only cost, as there is no training, supervision, or monitoring. Hidden risks include the family or senior may be liable for a caregiver's in-home injury. And costs, although usually less expensive at the outset, the family or the senior is considered the employer and is responsible for paying government-mandated taxes. Key issues to consider before selecting a private duty home care provider include the levels of care provided by the agency and the type of agency. Does the agency offer companion and homemaker services, personal care, and/or skilled care? Is the agency type a registry versus employed staff? Do they accept Medicare, Medicaid versus private pay only? And is the agency licensed or unlicensed? Also be sure to consider the procedures used for hiring care staff. Do they offer criminal background checks, credential and reference checking, competency testing, state abuse registry checks, and orientation procedures? Consider the care management practices of the agency. What are the initial client-patient assessments, ongoing client-patient assessments, communication with family and medical providers, training of staff, written job descriptions for care staff, procedures for staff evaluations, disciplinary counseling procedures, and scheduling procedures? What are the background and training of the care managers? Does the agency have a nurse care manager available if providing personal care level or above? Does the care manager above provide initial or ongoing assessments? And are care supervisors available 24 hours a day? Living at Home SeniorCare's caregivers are employed, bonded, insured, and supervised. We also thoroughly screen and check references for our caregivers before employment and offer ongoing training. If you would like to learn more about how we can assist with your home care needs, please contact us at the information shown below.